Assalamu alaikum. Good afternoon, good morning, everyone. Good afternoon. My name is Irfan Khan. I'm the CEO, the group CEO for Evercare Group. We have hospitals in Nigeria, Kenya, and Pakistan. 5 hospitals, 21 medical centers, and 75 diagnostic centers across these countries and continents. Evercare Group is a PE-led group. Private equity is TPG, which is based in San Francisco, USA. And it's a $1 billion fund for healthcare. So today what I'm going to talk about, and before I get into my presentation, I just want to congratulate the organizers, the convener, Dr. Zaki, for putting this together. I think this is really important for Pakistan. And during my presentation, I'll talk about how I'm trying to showcase Pakistan. I'm a Kenyan national. I was born and brought up in Kenya, but my roots are from Pakistan, so I have my heart in Pakistan and always trying to give back and do good things. And this is part of the vision that we have for Evercare as well. Also, it's good to be back in Karachi. I was going to say beautiful Karachi, but I don't think it's beautiful, but it's vibrant. And it's very hot today. But it's good to see colleagues who I've worked with from Aga Khan University Hospital especially, and very nice to see everyone after many years. So I'm going to take you through a story, a journey here, and hopefully it'll be interesting, and I'll keep it under 10 minutes so we can have some questions later. I'm happy to take questions and interact with you all as we go ahead. So Evercare, so this is about today. What I'm going to do is, I talked to Dr. Zaki. We are talking about inward medical tourism. I'll talk a little bit about that and how all these things relate to it. We've just heard AI, technology, smart hospitals, and then obviously quality patient safety is a very important aspect that needs to be looked at. So I've themed myself around this. At the end, I will also tell you something interesting about the lion, the eagle, and the markhor. So let's wait for that, and it'll come at the end. So I'm going to just quickly show you what Evercare's vision of the future hospital is and how we're going to take this forward. So quality has to be the pillar. Like I said earlier in the session, quality and ethics in healthcare is absolutely essential. Unfortunately, in our emerging markets, when it comes to education and healthcare, quality and ethics are not even on the list, unfortunately, sometimes. But they need to be at the top. And how do we make this happen? These countries that we work in, and arguably I think the countries in Africa and Asia that we work in, are the most toughest emerging markets in the world. We don't have sometimes basic things happening. And I'll tell you a quick story there, that recently you must have heard the big flash floods and rains that happened in Dubai. And the Dubai government declared an emergency, everyone stay at home, everyone work from home. I landed in Dubai that day at the airport, and I got from the airport to our office in DIFC. And yes, there was water, and it was, but it wasn't as anything like our countries. It rains in our countries, and in Nigeria, for example, I can tell you, it's impossible for workers to get to the hospital. They get up with no electricity, no transport. Yet they get to the hospital with a smile on their face and do a good job. That's the environment we live in. So how can we make this environment conducive? And how do you then do advanced technological things in these environments when you don't have even the basics? So quality and ethics, I think, to me is absolutely important. Patient safety and experience. So we talk about patient safety, but experience to me is also something important, and I'll show you later in the presentation what I mean by experience. Today's patient is very empowered, and the experience that they want is almost a hotel-type experience that they want in a hospital, irrespective of which category of society they come from. Digital health, and I think there's a lot of focus nowadays on digital health. And it's very important, and it can really help. So how do you create access? What I'm trying to nail in our markets is low cost, high quality, high volume. How do you break that? So I was talking to Arshad Saab. The SSP is an amazing program. The Sehat Sula program is universal health. How can we take this forward? It really showcases Pakistan in a good light. A country like Nigeria does not have universal health. Kenya has a very good NHIF program, but it's going through all sorts of problems where we have learned from there. So we can give back to SSP as well and give them the lessons learned that we've had in those countries. Affordability, accessibility, I talked about that. And then, the impact that we have. We serve almost 4.3 million patients in our countries. We align with the United Nations SDG 3. Community engagement is a big one for us. And ESG is another buzzword along with AI nowadays. And how do you get the environment, the social, and the governance aspects correct? So let me now go into more depth in all these areas that I've just shown you and tell you how do we operate. So in Evercare, my belief is, we talk about patient experience in a hospital, and this is the buzzword. But in my view, it's not about the patient experience. It is about the employee experience. The employees have to come first. You must retain, you must attract, retain, and train the right talent. Because who is going to give that patient experience? It is your employees. If your employees are disgruntled, they are not paid well, they are burnt out, how is that going to translate into a patient experience? So at Evercare, what we do is the focus and the base is employee experience, which leads to a patient experience. At the centerpiece has to be clinical quality, which I've already talked about. But then also community engagement is a very important aspect. And by community engagement, it's not just what we normally do, is health camps, et cetera, but I'll give you an example of our hospital in Lahore, which is just past the Shaukat Khanum Hospital in Wabda town. It's a 150-bedded hospital. It's a beautiful building. And it's fully equipped. It's got high-tech equipment. And like the previous speaker was saying, that's the easy part. The technology is the easy part. Setting up a hospital is an easy part. Spending the money is the easy part. Buying the equipment is the easy part. Running it and getting the right services is the tough part. And if you do that well, the community that you can affect around your hospital. So when we started this hospital in Lahore, first 2 years, it totally failed. It was a failed hospital, and nobody even knew about it. Although this was an $80 million investment. Now what happened? Again, we had the beautiful equipment, we have everything there, but it was the service level and the leadership that was missing. Now that hospital is known for, the area that it sits in has grown. So there's a bakery that was next door. It was completely, not doing well. Now, the owners recently came to say thank you to us, to say, because your hospital is booming, our business is booming. All the businesses around that area have started to boom. That's the engagement that you have with the community. That's a positive effect that a hospital, if it's run correctly, has, in the market. Now, those 4 things automatically lead to volumes and revenues. Like I said, the first 2 years of this hospital was not very good, not profitable at all. In the last 2 years, we have turned it around. We have increased revenue by almost 300%. We are positive EBITDA now every single month. Last year, we finished positive. And it has opened the eyes of our investors, because they always looked at Pakistan as a failed state, a failed country. And then suddenly they're seeing there's so much potential here. And the potential is not just financial, but it's also engagement. It's also public-private partnership. It's also community. And that's the beauty of it, that the double impact is what I call it. It's a financial impact, but also a social impact. And they don't have to be exclusive. They can both work together if you do it correctly. So what do we do? And this is what I call the game changer. These 6 things are the game changers for us. And the most important one to me is make life affordable. Because again, in our countries, life is tough for our employees, for our patients. How do you make life affordable for your patients and for your employees? Experience and satisfaction, quality, safety and operational excellence, quality of life for communities, I talked about that, people excellence, innovation, digitization, and technology. So I'm going to go into those in a little more detail here. And really the focus areas that we have like I've been saying again and again, is quality and ethics. How do you do that? You establish centers of excellence. You have your guidelines when you follow accreditation processes. For example, JCIA. That's what we are doing. We are following those processes. In Africa, we follow COSASA, which is a South African accreditation. And it's important because it gives you those guidelines and it puts things together. In Punjab, we have the Punjab Healthcare Commission, which is also has got a very good system. But how do you ensure that quality is not just paperwork? It's not just preparing for auditors to come in. Quality has to be a way of life, day in, day out. When an audit is about to happen, you shouldn't really need to prepare. You should prepare 10% of it, but 90% should already be running. That's the real essence of quality, and again, very tough thing to do. Innovation, technology, community health engagement, financial operations. Now, when it comes to financial operations, one thing that we always talk about, even for non-profit hospitals, the bottom line has to be healthy. You cannot have an unhealthy bottom line. How much are donors going to give? There's donor fatigue. But even when the donors give, that money should be used for further expansion, replacement of equipment, etc., rather than operational expense. How do you make your operations run well? And one of the things I've seen in our markets is that you may register the revenue, but you don't collect the revenue. And this is a major issue. And again here, I want to appreciate the Sehat Sahulat program, because usually the governments delay payments. In Kenya, we have this major issue. Outstanding from the government, services provided, patient treated, gone home, money not collected. So it's registered, but not collected. Doesn't help your bottom line. In Pakistan, the Sehat Sahulat program has never delayed payment. Never delayed payment. It's absolutely amazing. It's world class. But it hasn't got showcased out there. How can we showcase this? So financial discipline is absolutely important. I have found in our markets, getting the right financial team is a very difficult task. Finding the right finance people, they are not trained in disciplined collections, revenues, and your costs. So how do you get lean cost, for your bottom line? Arguably, again, in our countries, we have a lot of wastage in our systems. There's a lot of wastage that you see, and you need to figure that out. Going forward, this is what I define the value as. It's quality and service over your cost. And really where you should be is in that quadrant there that you see on the top left, where quality is high and cost is low. And easy to say, very difficult to achieve. Very difficult to achieve. How do you keep the cost down? How do you keep the quality up? Very, very difficult to achieve. But I'll be happy to share with some of you who are interested how we are doing this at Evercare, because we have actually managed to do this. And it's all about partnerships. We were talking about collaboration earlier. We have partnered and collaborated very well with many different organizations in Pakistan and outside of Pakistan. And that helps and allows you to improve the quality and keep the costs down. So today's patient, like I said earlier, is informed, empowered, expects transparency, is value-driven, needs convenience, and wants customization. So we saw a really good example of how customization can happen, how AI can help, how digitization can help. That's what today's patient requires. And the patient journey really is obviously a clinical experience. They want a good clinical experience in the hospital. That goes without saying. Nowadays, patients want a good physical experience. That's why you see the new hospitals that are being built are beautiful. They have nice lobbies and nice entrances and plants and all sorts, because patients want that. They want good food in a hospital. So the physical experience is also important. Today, the digital experience is important. Before anyone has even walked into your hospital, they've checked you out on social media, they've checked your website, and that is an important one. But the last one is what we always miss. And someone talked about it earlier, the emotional experience. Anybody walking into a hospital, what is the difference of walking into a hotel, a bank, etc., is that a hospital, somebody is hurting. Your mother, your father, your brother, your sister, somebody is sick. You're not sure how much is this going to cost? You're not sure where you need to go. You're not sure how long it's going to take. You're emotional. And here we see, because of that emotion, anger. People frustrated. And all it takes is opening a door for them, sitting them down, giving them a glass of water, a cup of tea, talking to them. So one main thing I have seen in our hospitals is the lack of communication. Communication between us and our patients and the families of our patients is lacking big time. And I think if we need to do anything apart from the high technology stuff, it is communication. This needs to be improved, drastically. So the emotional experience is something that really needs to, be looked at. So how are we, transforming health? Capacity building, healthcare, workforce training. Very important. We are setting up simulation labs in our hospital in Nigeria. We are setting, and we are opening it up to the community, not just for our team, but for other teams. How can you enhance the workforce and continuously train? Retention of workforce is a major issue in these countries, not just nursing and clinical, but also management. And so what we are doing at the Evercare Group is we train young leaders. We train our young managers, assistant managers. We train them to be future CEOs, COOs, CFOs. Instead of going around the world and finding the best of the best and plonking them and bringing them into our difficult countries where then they don't understand the culture and the politics, what we are doing is building from within. And this is hard work, because it means I have to be very much on the ground, I have to be watching carefully, and I have to be grooming and guiding. But it's the long-term plan that works, because it retains them, it makes them feel satisfied, happy, and respected, that they're now being trained to do something for themselves. And then you have strengthening of healthcare delivery, so health days, health camps, etc., very important. And then we focus on women and children. So, birth anomalies, women's surgeries, and these are projects that we have done. So we have an Evercare Foundation that funds these. So we have done cochlear implant surgeries free of cost for children under 5, for poor families who cannot afford it. And we do this across our 3 countries. And it's an amazing program that really touches and changes the lives of these people. The first child that we did is now happily going to school and progressing. So it not only changes the life of that child, but the life of that family. So these link to our strategy. If you looked at my earlier slide of the strategy, that's it links to this. So everything that we do is very much linked in the way we manage the things. And these are some of the pictures that we have of the value and the impact that we do. The cochlear implant surgeries, we have recently now collaborated and partnered with the World Bank and IFC for quality. And the World Bank came to me and said, you have managed to turn around hospitals in these tough emerging markets. We have government-funded hospitals that we have funded, and they are unable to make these hospitals run well. Again, beautiful buildings, the best equipment rotting away. Can you help us turn these hospitals around? So we are now linking with the World Bank to go into these tough markets and turn these hospitals around. How can you put all these factors in there? And actually, if you look at it, it's a very simple formula. But there's a lot of talk around this, but we talked about this earlier, is execution is what lacks. And if you can get the execution right, that is what gives you the results. But I also want to bring up something different here. And this is the need for medical humanity, is what I call it. Because, and somebody mentioned this in the earlier session, So I like this quote. It's a Chinese proverb: a man without a smiling face must not open a shop. And I think it's the same for the hospital. You have to have the attitude for service. You have to have the culture for service. And that is, absolutely important. So in ancient times, you used to have people-centered care, a harmonious doctor-patient relationship. There was a philosophy of kind-heartedness. But in the recent times, we have had this technology advancement. Everything is technology, technology, technology. Everything is AI-driven. You lose the human touch. You start to lose, your focus is on diseases rather than the humans. And I think this is very important. So I would like us to come back to that human touch. Yes, use the technology, et cetera, but the human touch must be there. So to cure sometimes, to relieve often, to comfort always. That is how we should be planning ourselves. And this is what links to inward medical tourism. If we can do this correctly, that is what will attract people to come, right? This is a difficult country to attract people to come back if they are not from this country. Who is going to come here for tourism? It's very tough. It's very tough to attract them. Who's going to come here for medical tourism, right? But there is a way to do it, and I think we must all strive to get there. So I leave you with this question, really. It's in an uncertain and evolving world of healthcare, what sets transformational organizations apart? And it's a question that we can never answer fully. It is always continuous answers to this question. But that's something that I leave you with. And I promised you that I'll tell you about those 3 animals. So the 3 animals are basically, the lion is the national animal for Kenya, the eagle is the national animal for Nigeria, and the markhor is the national animal for Pakistan. And using AI, it generated this image from the 3 animals. And that's what, our 3 countries have deep-rooted, strong cultures. And as Evercare, that's our one vision. Strength and vitality comes from the lion, powerful, sustainable, the eagle and the markhor and the eagle source. So that's really where we come from. So thank you very much.